Okay, so my name is Jenna and I am the manager of aquatics at Western. Thanks for joining us today for the Aquatics Webinar. Hopefully you guys are all in the right place. As mentioned, we are starting email lists, so if you want to input your information there. What I've done to start off and to get some discussion going here is I've come up with a few polls just to give us some topic areas. So I'm just going to throw one up here. Just to even start to see where we're heading. So will your facility be closing down change rooms when you reopen? Yes, no, undecided. Perfect. Awesome. Okay, so we have 1 out of 7 saying yes, and 7 out of 8 are undecided. Perfect. So you can see there that people aren't really sure what's happening. At Western, our indication at the beginning anyhow is we don't think we're going to reopen the change rooms. And the reason I ask this is because if your change rooms and your showers aren't open, it obviously is not meeting the health regulations for your pool. So that's kind of a game changer as well that we need to think about when we are reopening the facility, and specifically the aquatic facility there. So for the person who said yes, how are you going to maintain cleanliness in that facility, if you feel comfortable speaking up?
Hey, Matt from Ryerson. I was the yes, I think. And my understanding is that our plan for reopening as it exists right now, and everything's fluid in all ways, is that the building will kind of open in time slots. People will be asked to show up to the building ready to exercise, like in their clothes, not needing to change, come in, get access to the equipment, get access to bikes or whatever for a time slot that they've signed up for. And once that time slot expires, everyone leaves, everything gets cleaned, and then a new time slot opens up after that cleaning. That works for the fitness center, or that works for the fitness center for cardio rooms. But yeah, if the change room can't be open, then, well, if the showers aren't open, then unless we're gonna rig up a hose, then it's kind of hard to get people clean for the pool. So the pool might not actually be part of the initial opening.
Yeah, and that's kind of one of the things too, right? We're not always thinking about the little things, but yeah, no, that's awesome. Very cool idea to totally shut down and do a full clean before you you swing in with another group. So that's awesome. Anyone else have anything that they wanted to touch base on change rooms before we go to the next poll?
I have heard of some groups that are considering having one-way in and out, because that, the pinch points of the entrances are the biggest issue. But I don't know what you would do in the locker room to keep people, the 6 feet apart. And I don't even think we would allow locker use if we reopen anyways. So yeah, I'm not sure how that would work in a lot of change rooms, whether that's even a possibility, but I have heard that at a few US schools.
Tricky questions here. Perfect. Yeah, and that's the hard part too, right? Is how do you know what's going to work until someone dives in and takes one for the team and figures it out? But yeah, it's absolutely going to be a vital process that if you do reopen your pool, to have a very strong change room process and policy in place. Perfect. Okay, so we are going to move on to the next question, number 2. And you might not know this because it's not specifically to your area, but towel service kind of goes with the aquatic portion. So will you be offering towel service at your facility? Okay, we'll give another second. Perfect. Okay. Matt, are you yes again? Oh, you're muted.
Would have been someone else, I hope.
Okay. I was going to say Ryerson's on a roll here. Perfect. So towel service, again, just going back to that, cleanliness. It looks like here 4 out of 8 said no. Can you not? Sorry, I realized I can't really share. There we go. 4 out of 8 said no. 3 are undecided. Again, I think this goes back to the bigger question again, is how are we going to maintain strong laundry services there, and the collection of dropping in and your staff, I can't think of the word, your staff handling them into the washer and things like that. Perfect. So those were the easy ones. Now we're going to dive into more of the in-depth questions that we have here. So what we'll do is the areas that I'm looking at are virtual training, reopening processes, lessons, and standard first aid. So is there a topic that anyone really wants to dive into first? Nobody?
I'm quite interested about certifications in first aid. I'm just one person.
Perfect. And we got lessons. Debbie?
Great. Training.
Training. Okay, so what we'll do is we'll go training, because I know Debbie's going to leave, so we'll get her some information, and then we'll jump to SFA and lessons. It'll all get covered anyways, so we'll head down this way. All right, will you conduct any virtual training prior to opening? Yes, no, undecided. Perfect. Okay, so we are divided almost in half here, which is awesome. So 4 say yes, 4 undecided, and 1 says no. So perhaps we can start with the yes category, who can maybe help those undecided, giving some ideas of how you think you will navigate this, what training topics you will be covering, how you're going to ensure that staff are completing this. So if anybody wants to jump in here and share what they're doing, it would be awesome.
I'll jump in.
Thanks, Laura.
We're not really entirely sure exactly what we're going to do, because the entirety of Queen's Aquatics needs an overhaul for pretty much everything, including like staff training and manuals. So one of the things that we're trying to, or at least I'm trying to work on, is putting our staff manual and those policy procedure pieces into digital formats ongoing anyway. But this might be a great way to start with refreshing staff on just what they should be doing when they're at work and policy updates and so on. From there, I think definitely offering some of the digital first aid updates from an informational standpoint would be an easy transition as well. And then trying to logistically figure out when everyone's back, what might have been missing, what really actually does need to be done in person. If some of our staff have their own ACTARs or other types of training equipment at home, can they send in video footage of themselves doing their rescue techniques, and us as instructor mentors offer feedback on what they can improve or what they can change, or maybe use that as exemplars for other staff to be like, hey, take a look at this, incorporate that into your pre-season training and research kind of ideas.
That's awesome. Thanks for sharing. Anyone else?
I think from our perspective, we're going to do everything that we possibly can digitally. The issue that I'm having the biggest concern about is our pool is so deep, and so the physical skills required to get to the bottom, just overall fitness, I think, is going to be impacted by the fact that people won't have had access to, a lot of people won't have access to water, maybe some people at cottages, etc. So the fitness level is going to be a bit of a concern for me. And the only way to get people to do that is to actually go in and pick up a body off the bottom. I mean, you can pick up a brick, but really bottom line is, if you can't manipulate a person because you're just not able to anymore because you've lost strength and fitness, that's my biggest concern, and how you screen our staff to still be able to rescue somebody, wearing full PPE, well, not full PPE, but some PPE is going to be really challenging. I don't even know if it's doable. So I'd love to, if anybody's got any ideas on how they're going to manage that.
Yeah, and that's a good comment there, because the one thing that I've kind of started to do interviews thinking we were going to need summer staff, which I'm not sure is going to be the case anymore. But we did a Zoom interview, and then we were going to go through with a skills process. because obviously that's a requirement, but we were going to have them come in a day or two early to just practice, knowing they haven't had access to the facility, to complete those activities and just kind of get back into the groove of things, as opposed to bringing them right back into their interview. Because like you said, is no one, and especially at this point, no one's seen a pool in 60 days unless they have one at home. But that was kind of the notion that I was going to go off of, is to give them that time to come back into the facility before we open, to run through their skills themselves. But then again, you go into how do you complete a spinal rollover safely given everything that's happening, right? Like, are you wearing gloves and you're wearing a mask now and that's considered safe, or are you still unsafe because we're not within that physical distancing, right? So I go back to the, well, is it life over death? And do you risk, you know, that getting COVID to save someone's life, or that kind of conversation is going to come up. But that's what we're going to do anyhow. And I think it's going to be navigating that physical touch to complete those rescue skills.
Jenna, just to jump off of that though, you bring up a really interesting point of if we're in a position where someone's life needs saving, then we want to save that life. But I think of that from a Ministry of Labor perspective of, are we as supervisors putting people in a position where they will be forced to eliminate physical distancing? And I know from the camp's perspective, there's I don't know about surprisingly, but a noticeably strong position from the Ministry of Labor that camps would only be allowed to operate if counselors could be positioned such that they are physically distancing. And I would be surprised if the same expectation wasn't held for lifeguards, which is a really hard thing to wrap your head around. Like it strikes me as early on as an intractable problem.
Interestingly, I know that some municipalities put their lifeguards sort of at the same evaluative level from the HR perspective with firefighters and ambulance attendants. So, you know, we know that those folks are continuing to do their work, and they've put PPE in place for them to be able to do that. But, you know, aquatics isn't the only area where we might potentially have to do first aid, right? Like, you know, the pool's not exclusive to first aid, you know, incidents where first aid is required. So, you know, that problem is across our entire department.
Yeah, I agree with you, Debbie. But a difference between aquatics and like firefighters is that it's like an opt-in activity. Like unless you're going house burning. Firefighters. But yeah, sorry, I hate to be a person that just brings up problems and doesn't offer solutions.
No.
Love the problems. We all got to think through them right now, Matt. So it's helpful to vocalize them.
Yeah. I think some things might not have a solution.
Mm-hmm.
So.
And we hope that, you know, I'm assuming all of us are going to have to do temperature checks with people coming to the facility. So, you know, we hope that we're going to catch things as they're coming in, but again, you never know, right? So it is definitely one of those good points of what are we going to do about this? And I don't know, I've only been able to catch a few of the LSS sessions, so I'm not sure if that's even come up yet. Debbie, I know you've been on a few as well.
Yeah, there are some resources on their website. Not a lot of training detail yet, but that's coming.
Okay. Anything else around training? I think it's going to be figuring out, like we've said, is the physical closeness in terms of the safety and the rescue scenario. Whereas, you know, as Laura mentioned, there's a lot of amazing ways that we can connect with them virtually, from staff manuals and reaching out in terms of what staff need to do. Like the one thing I was even thinking of is we're going to have to train them now in the staff office. How do you physically distance in a small pool office? And kind of covering those little topics. So those are the things that can be done virtually, but I think those are the minimal concerns that we're having right now. Okay, anything else in terms of staff training? Anyone been finding any amazing things that they're going to be using with their teams?
I had one thought for equipment, is that how I don't know if anyone else is starting to think about budgeting for additional purchases of equipment, because we will probably need to be supplying staff with all of their own personal, say pocket masks, their own sets of gloves, additional cleaning supplies for wiping down our mannequins in between, just to kind of help that process of things. So I didn't know if anybody has found any good places for bulk ordering or anything like that they wanted to share.
I don't know, in regards to Laura's comment, I know that we've even looked at when it comes to like pinnies that our staff are wearing on deck, purchasing one per staff, so each staff can have their own, which will be quite an exorbitant cost, but definitely worth it to keep our staff safe. So
we were just given direction that we're not allowed to buy any kind of PPE through our department. It's all going to be purchased centrally. And so if that's a requirement of the job, there's going to be a whole evaluation process that will be done through our risk management central program. So I'm not sure if that's happening at other universities, but that was just announced with us.
Yeah, we haven't really taken a peek. I haven't specifically, because I know our facility manager has been the one that's really sourcing things out right now and determining what we're going to need. Unlike Caitlin, all of our staff have their own uniforms already, so that won't be something that we have to really work through. My thing with staffing is going to be, are we going to need the same amount of staff that we've had up to this point? Because I'm projecting that our facility hours for the pool will decrease. So then are we going to need the same amount of staff that we've been using up to this point? So, going back to the staff training, if we're not bringing on a whole brand new team and we're utilizing our returning staff, then the training might also look a little bit different than if we had a big new team. But
Anna, can I just ask you a question about what you said? Are you expecting reduced hours because of lower demand?
Yeah, lower demand, but also the amount that we're going to be having. Thanks, Debbie. See you. The amount of people that we're going to be allowing into the facility, right? So I think we have to look at what are the pool stats been up to this point, and Western's looking at a blended model. So potentially 8,000 to 10,000 students on campus as opposed to 30 or 40,000. So knowing that there could be that decrease as well, and swimming is not typically always a popular area for our students. The weight room is always full, but the pool, tends to have less usage compared to the other areas. So it's also a much more expensive area to run in terms of staff wages and the chemicals and all of that. So looking at, can we decrease the hours and what that may be? But again, everything right now is all little bubbles in the sky and having no idea where we're going and just putting them all out there and seeing kind of what comes back in a few weeks. But like I said at the beginning, everything is changing weekly. So, we don't really know what direction we're going into, but it's just kind of thinking that there may be an impact on the number of staff that we are allowed to hire or that we're required to hire. Anything else on training? Okay. So as promised, we will move down to, Matt, we'll take a bit of a blended approach with this one. So are you going to be offering SFA courses? So we'll start with that, and then we'll move into staff qualifications. Perfect. Thank you. Okay, so it looks like we're divided here. So we have some yes and some undecided. So is anybody comfortable who's going to run with the blended approach able to speak to how they're going to design that?
I'll go again. I'm going to take most of the direction from the Life Saving Society itself in Ontario with the online programming that they have already developed. Myself and one of my advanced instructors have been piloting Google Classrooms already, especially with our NL classes, because there's just so much non-aquatic content in there where you're not having to get wet, that we wanted a more accessible way to deliver that for our students. So she's been working around with that, and I think that's a fantastic way to do it, as long as it's, you know, okay within your university to use that platform. They may want us to use the ones they've already paid for instead, like Blackboard Learning, or what I think ours is, I don't even know, On Cue. I don't remember who provides it. So we're going to try that. And I think with the standard first aid as a blended, having, if we run it over 2 days or 2 weekends, depending on the time frame that these are offered in, do your theoretical content and then have booked spaces for the individuals to come in, if we can do it in, say, pairs or groups of 3, to work through the assessment content. It will take longer for people to get their certifications, and it will require a lot more organization in terms of getting your registrants in and then telling them what, or, you know, having them perhaps pick the times that they can come in, and will probably cost more because it's going to run more than 16 hours in this manner, but it's to be determined. We'll have to kind of see how that goes.
That's awesome. So are you developing the content and the theory right now in hopes that LSS is going to say, yep, go ahead, go for it? Because I personally haven't heard the go ahead yet, unless I missed the memo.
Yeah, we're just kind of waiting to see a little bit of that. I've already done a lot of work with doing advanced instruction for years before, so I have a lot of digital content that I already created, but it needs to be updated because it hasn't been in like 2.5 years, which isn't the best. You know, you don't always have time. So we do have at least a baseline of information to start with, and then pilot it out when we get the green light. And as well, like, I have to keep in mind that Queens may have a different idea on how they want some of that programming to run. Mm-hmm. So then making sure we're in compliance with what the university is looking for, what LSS is seeing as okay, and if WSIB will say, yeah, this isn't okay to deliver that information. If they're like, no, that's not okay, then we're gonna have to go back to the regular way of doing things.
Yep, absolutely. That's totally fair. Thanks, Laura. Anyone else who said yes to the blended model wish to speak to that? Crickets. Love it. Okay, Matt, go ahead.
I don't have anything to add on what Laura mentioned, but I am curious for those who are planning on delivering some component virtually or digitally. Are you thinking of doing it live, like in a Zoom call that we're all on, or a pre-recorded video that's hosted on Google Classroom?
So looking at what I'm considering is doing Zoom classes so you can see the participants and see that they are engaged in the material. I personally was going to break up the theory over a few days because asking someone to sit for 4 or 8 hours on Zoom is not really fair or realistic. So looking at maybe doing sessions of 2 hours, like once a week for 4 weeks or something like that. And then before they come in for the practicals, to do like a 1 hour refresher on Zoom, and then come in and do the test. And then, like Laura said, is do small groups where they can demonstrate the skills. But that was something that we were looking at doing, is having like password protected and kind of more small chunks versus full day like they normally would do. Okay, anything else on that topic? Perfect. Okay, Matt, you wanted to talk qualifications.
Oh, I think you blended them pretty well. That's what I was curious about, how people are solving that problem.
Perfect. All right. Excellent. And like we've learned, LSS is being really generous with the expiry dates on qualifications. So how are people going to ensure that those, and this goes back to our kind of first big question, that staff are recertifying their NL? And I don't know if we can answer this given our first question of physical distancing. Not really, it's not something we can avoid, or it's something we have to be able to avoid but can avoid in rescues. So what are people looking at? Are you just encouraging them to get it done within the 60 days, or are you offering those programs for staff only? What does that look like on your campuses?
I'm hoping to incorporate it into the training itself. Like, our training is going to be much more lengthy than it normally is, I think, at this point. And what I would like to do is be able to offer the ability to get them all assessed, at least my returning staff. New hires, if we have any, like you said, we might really not even need most of our returning staff this time around, may have to do a recert with us before they can even come to an onboarding session, just to see how that goes. And knowing that some of those skills may require multiple attempts to get. So say you have, 15 returning staff and you have a group of 4 that's really struggling with object recovery and their distance swim, having a program in place that allows them to continue to practice over, say, the first week of your opening so that they can have another chance at proper evaluation. But it will be hard to know. Some people, might feel a little tired more than usual, and won't struggle as much with the physical skills. And there will be some where they just can't really do any of them at all anymore and kind of have to start back from square one. So it'll be interesting to see how that looks when they come back.
Awesome. Perfect. Anyone else for qualifications, questions around that SFA before we move on to the next one? Perfect. Okay, so we will move down to lessons. All right, will your facility offer swimming lessons when you reopen? Yes, no, undecided. Okay, give me another second there. Okay, so this one's pretty clear. We have 1 who says yes, and then everyone else is undecided. Does that individual who said yes feel comfortable speaking to that? Okay. So undecided, what are the questions that you guys are having at your facility in terms of whether you can offer swimming lessons or not? What are maybe the conversations that people are having to determine if you can facilitate the lessons or engagement of your participants?
I think something that as a trend that we've been discussing, I know I was in on the Life Saving Society webinar a couple weeks ago. It's just more so, are we going to be basing them more so like private lessons so that there can be more spread out? Are we going to be basing it on regards to, families can swim together and perhaps having a parent in the water to help assist with physical manipulation in the water? Those are just some of the things that we have been thinking about. I don't think that we'd be looking at going back to regular large lessons. We definitely have to minimize that and definitely map out our pools better to where each lesson will be being held.
That's awesome. Thanks, Caitlin. And do you foresee your staff wearing PPE when they're in the pool with your participants?
I have no idea. I don't know what exactly that looks like. Yeah.
It's totally fair. I don't think any of us do. Anyone else want to jump in with questions or dilemmas that they're having around lessons?
We were looking at, like, one, we have to wait for the direction from any of our health ministers and experts in the field on what about that kind of setting is appropriate. And reiterating what Caitlin said is I'm having to build multiple models of what we could do. So if everything is normal, what does that look like? And how much is that going to cost us at the end as well? So then breaking it down. So say it's a blended of group and private, then only privates with no breaks in between the half-an-hour sessions, to privates with 15-minute gaps between every lesson set, and what other programs do we have to manipulate around or not renew into that pool space. Queens has an extremely busy 4 to 7 p.m. window Monday through Friday, where we'll have competitive people in the pool, other rentals, lessons, and lane swim all at the same time. It's our highest volume hours of the day. And my advocation right now is that since lessons are bringing us in our revenue to sustain a lot of our other programs, then we need to make accommodations for them if we want to run them. And then similar to Caitlin, I'm wondering what kind of PPE we can have. What about PSW support in the water? How can we actually block out space properly? Because we don't have a very shallow pool, but people love doing preschool lessons with us. So how do you do that when those kids pretty much need to be held the entire time? And all these other interesting aspects. Then of course the change room piece, well, how many families can be permitted into the change rooms at once? What does that look like coming in and out of the deck? Can parents even sit on the deck, or do they need to go upstairs to our viewing gallery while their children are in the water to continue to keep space? So lots of questions, but very few answers at the moment though.
Don't worry, you're not alone. We're all in the hundreds of questions and 0 answer categories. So perfect. Anything else around lessons that you guys were hoping to ask or discuss? Perfect. Okay. So we will move on to reopening. And again, I think I'm kind of shooting into midair here. Do you have a reopening time frame? So June, July, August, September? Great question. I wish I knew. Okay. So we have one that's saying September. Otherwise, no one has any direction here in terms of reopening. Now, is that your facility reopening or the pool, or is your pool and facility reopening on the same day?
Sean here. Unclear. I think September was the last date that you had on that list. And so I'm actually thinking potentially later than September normalcy. But right now with the facility closed, the focus is on maintenance of the facility. And then kind of we'll see. But I also have talked to some people who think that regular aquatic programming may not resume until, say, January 2021.
Okay. Interesting. Anyone else?
We've also been asked to make a plan for our pool not to open till May 2021, that potentially it could be closed that entire time depending on what kind of learning model Queen's decides to go with, and whether or not we continue to ask students to pay fees towards our athletics and recreation programs. Because if that stops happening, then we can't afford to open a lot of these things, especially the pool. So I'm not sure. We kind of have to build out. It could open in August, could open in September, could open in January. For now, my plan is that I've asked for 8 weeks of advance notice to not only fill the pool and get it all inspected and ready to go, but so I can slowly bring staff in and start building out all of the other digital pieces, facility pieces required so that our staff can transition back in safely, and so can our people.
Awesome. Yeah, and I think that's what a lot of us are looking for too, is that advance notice, especially given the staff training that's going to be required for those who haven't seen a pool, which will be basically everyone at this point. So yeah, 8 weeks is a good time frame. That's awesome. Thanks, Laura.
Jenna, I ditto Laura's comment, and I also think, I don't know if anyone else has seen it, but Swimming Canada has developed sort of a framework towards swimming resuming, and that could be a good indicator of what, and there is, I guess, collaboration between both the competitive side, the Life Saving Society, and some other groups on what returning to swim looks like. And so that could guide what activities resume in our facilities. Is it going to be some limited high performance training or individual training? Is it going to be those very structured activities or private swimming lessons? And then something like a rec swim, you know, may not resume until the summer of 2021, right?
That's awesome. I'll have to take a peek and try and find that document. Thanks for sharing that, Sean. That's great. And just off of that, is anyone going to be integrating rentals as soon as you reopen? No one, I'm sure many of you aren't sure or aren't at this point. I know we've had some of our user groups that have reached out kind of asking if we have direction, and at this point, all of our rentals are basically canceled until June 30th. So we're waiting for our university to make those decisions before we say anything. But I'm anticipating that it won't be something that we look at upon reopening, just because it is, you know, there's sometimes bigger groups that are coming through. So we want to make sure that we can have our programs running successfully before we're bringing in other people. And I think when we reopen, excuse me, the focus will be mainly on the students in the campus community versus kind of staff, faculty, alumni, general public, things like that. Perfect. Thanks for sending that document, Sean. That's very helpful. Okay, are there any other areas of topics or discussions that you guys would like to bring up or brainstorm over the next few minutes? All right, I got a screen of names and nobody's saying anything. So those are all the topics that I had at this time. What we're going to be doing is selecting our June date. So is there anybody that would be interested in facilitating the aquatic session for June? Perfect. Okay, so I'll look at setting that one up again. If there's no other questions, it was great to chat with you guys. Thanks for sharing what you're doing on your campuses and all the different problems and issues that you're working through. As you'll see, there is that mailing list. So if you have questions or there are some amazing documents you've come across or created that you feel would be beneficial for everyone, please feel free to share because we're all in this together. So it's great to kind of have some support and have someone that you can bounce ideas off of. So have a great rest of your afternoon. Hopefully it's sunny where you are, and we'll chat with you guys in June. All right, take care. See you.
Bye. Thanks, Jenna.
Thank you. Bye.